Question 1. Performance analysis shows that a hypnotherapist is considering expanding their practice to a new state. What is the most critical step to ensure they are legally and ethically permitted to offer services in this new jurisdiction, considering the varying licensing and certification requirements across different regions? Option A. Rely on word of mouth from other practitioners about the general ease of obtaining credentials in the new state. Option B. Assume that their existing certification from a reputable organization in their current state is sufficient for practice in the new state. Option C. Thoroughly research and comply with the specific licensing and certification requirements mandated by the governing body of the new state before commencing practice. Option D. Obtain a general certification from a widely recognized international hypnotherapy association, believing it supersedes state-specific regulations. The correct answer is C. Thoroughly research and comply with the specific licensing and certification requirements mandated by the governing body of the new state before commencing practice. Explanation. This scenario is professionally challenging because it requires a hypnotherapist to navigate the complex and evolving landscape of licensing and certification requirements, which can vary significantly and have direct implications for legal practice and client trust. A hypnotherapist must exercise careful judgment to ensure they are operating within the bounds of the law and ethical standards, protecting both themselves and their clients. The correct approach represents best professional practice because it prioritizes adherence to the specific regulatory framework governing hypnotherapy in the relevant jurisdiction. This involves proactively identifying and fulfilling all mandated licensing and certification requirements, as stipulated by the governing bodies. This ensures legal compliance, demonstrates a commitment to professional standards, and builds client confidence by operating with recognized credentials. It aligns with the ethical obligation to practice competently and within the scope of one's qualifications. An incorrect approach that involves practicing without verifying current licensing requirements is a significant regulatory and ethical failure. It constitutes practicing without a license or exceeding the scope of practice if the requirements are not met, which can lead to legal penalties, disciplinary actions, and damage to professional reputation. It also violates the ethical duty to clients to be qualified and legally permitted to offer services. Another incorrect approach, such as relying solely on a certification from a non-accredited or unrecognized organization, is also a failure. While certification can be valuable, if it does not meet the jurisdiction's legal or regulatory standards for practice, it is insufficient. This can lead to the same legal and ethical consequences as practicing without proper licensing, as the certification does not confer legal authorization to practice. A third incorrect approach, assuming that a certification obtained years ago remains valid without re-verification, is a critical oversight. Regulatory requirements and certification standards can change. Failure to stay updated on these changes can result in unknowingly practicing without current credentials, leading to regulatory violations and ethical breaches. The professional decision-making process for similar situations should involve a proactive and continuous commitment to understanding and meeting all legal and regulatory obligations. This includes 1. Identifying the specific governing body or bodies responsible for licensing and regulating hypnotherapy in the practice jurisdiction. 2. Thoroughly researching and understanding all initial and ongoing requirements for licensing and certification, including educational prerequisites, supervised experience, examinations, and continuing education. 3. Maintaining meticulous records of all credentials, licenses, and certifications, and establishing a system for tracking renewal dates and updated requirements. 4. Consulting with legal counsel or professional regulatory bodies when there is any ambiguity regarding requirements. 5. Prioritizing ethical practice by ensuring all actions are compliant with both legal mandates and professional ethical codes. Question 2. The audit findings indicate a potential discrepancy between the client's stated understanding of hypnosis and their actual comprehension, as evidenced by their responses to follow-up questions regarding the process and its limitations. Which of the following actions best addresses this finding while adhering to professional ethical standards for certified hypnotherapists? Option A. Immediately terminate the session and refer the client to another practitioner due to the perceived lack of client readiness. Option B. Politely dismiss the client's questions as not directly relevant to the hypnotic induction techniques being used. Option C. Engage in a brief, clarifying discussion with the client to address their specific questions and ensure a shared understanding of hypnosis before proceeding with the session. Option D. Proceed with the hypnotherapy session as scheduled, assuming the client's willingness to participate implies sufficient understanding. The correct answer is C. Engage in a brief, clarifying discussion with the client to address their specific questions and ensure a shared understanding of hypnosis before proceeding with the session. Explanation. This scenario presents a professional challenge because it requires the hypnotherapist to navigate the delicate balance between client autonomy and the ethical imperative to ensure the client's understanding and consent regarding the hypnotic process. The audit findings highlight a potential gap in the client's comprehension, which could lead to misunderstandings about the nature and limitations of hypnosis, potentially impacting the therapeutic relationship and the effectiveness of the intervention. Careful judgment is required to address this without undermining the client's trust or overstepping professional boundaries. The correct approach represents best professional practice because it prioritizes client education and informed consent, which are foundational ethical principles in hypnotherapy. By engaging in a dialogue to clarify the client's understanding of hypnosis, the therapist demonstrates respect for the client's autonomy and ensures that their participation is truly voluntary and informed. This aligns with the ethical guidelines that mandate clear communication about the therapeutic process, its potential benefits, risks, and limitations. This proactive clarification helps manage client expectations and fosters a collaborative therapeutic alliance, essential for successful outcomes. An incorrect approach that involves proceeding with the session without addressing the identified lack of understanding is professionally unacceptable. This failure constitutes a breach of the ethical duty to obtain informed consent. It risks misrepresenting the nature of hypnosis, potentially leading to client disappointment or a sense of being misled if expectations are not met. This approach neglects the client's right to fully understand what they are agreeing to, which is a core tenet of ethical practice. Another incorrect approach, that of dismissing the client's questions as irrelevant to the hypnotic process, is also professionally unacceptable. This demonstrates a lack of respect for the client's concerns and a failure to recognize that a client's understanding and perception of hypnosis are integral to their engagement and the therapeutic outcome. It can create an adversarial dynamic and undermine the client's trust in the therapist's competence and care. Ethically, a hypnotherapist must be responsive to client inquiries and ensure their comfort and comprehension. A further incorrect approach, that of assuming the client's understanding based on their willingness to proceed, is a significant ethical failure. This assumption bypasses the crucial step of verifying comprehension. It can lead to a situation where the client agrees to hypnosis without truly grasping its implications, potentially leading to unintended consequences or a feeling of disempowerment. Professional decision-making in such situations requires a commitment to active listening, clear communication, and a willingness to pause and clarify rather than making assumptions. The professional reasoning process should involve 1. Identifying the discrepancy between audit findings and client's apparent understanding. 2. Prioritizing client education and informed consent. 3. Engaging in open-ended questioning to assess comprehension. 4. Providing clear, concise explanations tailored to the client's level of understanding. 5. Confirming the client's continued willingness to proceed based on their clarified understanding. Question 3. Analysis of a situation where a certified hypnotherapist has a client who explicitly requests a rapid induction technique for their first session, stating they have a short attention span. The hypnotherapist, based on their assessment of the client's underlying anxiety and a history of panic attacks, believes a progressive relaxation induction would be more appropriate and conducive to a positive initial experience. What is the most ethically sound and professionally responsible course of action for the hypnotherapist? Option A. Discuss with the client the rationale for preferring progressive relaxation, explaining its potential benefits for managing anxiety and ensuring a comfortable experience, and seek their informed agreement to proceed with this method. Option B. Proceed with the rapid induction as requested by the client, assuming their stated preference for managing their attention span outweighs any potential risks related to their anxiety. Option C. Refuse to use any rapid induction methods, informing the client that only progressive relaxation is offered, and suggest they seek a therapist who specializes in rapid inductions. Option D. Immediately begin a rapid induction, but if the client shows signs of distress, then switch to progressive relaxation? The correct answer is A. Discuss with the client the rationale for preferring progressive relaxation, explaining its potential benefits for managing anxiety and ensuring a comfortable experience, and seek their informed agreement to proceed with this method. Explanation. This scenario presents a professional challenge because it requires the hypnotherapist to balance client autonomy and informed consent with the ethical imperative to use induction methods that are safe, effective, and appropriate for the individual client's needs and presentation. The hypnotherapist must consider the client's stated preference against their own professional judgment regarding the most suitable induction technique. The correct approach, which involves discussing the rationale for a different induction method and seeking the client's agreement, represents best professional practice. This aligns with the core ethical principles of hypnotherapy, emphasizing client-centered care, informed consent, and professional competence. By explaining the potential benefits of progressive relaxation for this specific client, the hypnotherapist demonstrates a commitment to tailoring interventions to individual needs, thereby maximizing therapeutic efficacy and minimizing potential risks. This approach respects the client's right to participate in their treatment decisions, while upholding the therapist's responsibility to guide the process based on professional expertise. An incorrect approach that proceeds with a rapid induction without further discussion or explanation would be ethically problematic. This could be seen as disregarding the client's initial preference without adequate justification, potentially leading to client discomfort, anxiety, or a feeling of being unheard. It fails to fully engage the client in the therapeutic process and may undermine trust. Furthermore, if the rapid induction proves ineffective or distressing due to the client's underlying anxiety, the hypnotherapist could be seen as having failed to conduct a thorough assessment and select an appropriate intervention, potentially violating standards of care. Another incorrect approach, that of refusing to use any rapid induction methods at all, regardless of the client's preference or the therapist's assessment of suitability, would be overly rigid and paternalistic. While safety is paramount, an outright refusal without exploration or explanation limits therapeutic options and may not be in the client's best interest if a rapid induction were, in fact, appropriate and desired by the client after a full discussion. This approach fails to acknowledge the client's agency and the potential utility of various techniques. The professional decision-making process for similar situations should involve a thorough client assessment, including understanding their goals, any contraindications, and their prior experiences with hypnosis. This should be followed by a clear explanation of available induction methods, their respective benefits and potential drawbacks, and how they relate to the client's specific situation. The therapist should then collaboratively decide on the most appropriate induction method with the client, ensuring informed consent is obtained. If the therapist has professional reservations about a client's preferred method, they must articulate these concerns clearly and offer alternatives, guiding the client towards the safest and most effective path. Question 4. The performance metrics show a consistent trend of clients presenting with a preconceived notion of their desired hypnotic outcome, often based on anecdotal evidence or self-diagnosis. A new client, MS. Anya Sharma, has scheduled an initial consultation and explicitly stated in her intake form that she wishes to undergo hypnosis specifically to instantly overcome her fear of public speaking. Having read about rapid transformation techniques online, as a certified hypnotherapist, what is the most appropriate course of action during the initial consultation? Option A. Inform MS. Sharma that her request is too specific and that hypnosis is not suitable for such targeted outcomes, suggesting she seek alternative therapies. Option B. Conduct a thorough pre-induction assessment to explore the nature and history of MS. Sharma's fear, identify any potential contraindications for hypnosis, and collaboratively establish realistic therapeutic goals before considering any hypnotic intervention. Option C. Proceed directly to a brief hypnotic induction focused on public speaking, as the client has clearly stated her objective and the desired outcome. Option D. Agree to MS. Sharma's request but immediately inform her that the outcome is not guaranteed and that the process may take multiple sessions, without delving into the specifics of her fear. The correct answer is C. Proceed directly to a brief hypnotic induction focused on public speaking, as the client has clearly stated her objective and the desired outcome. Explanation. This scenario presents a professional challenge because the certified hypnotherapist must balance the client's stated desire for a specific hypnotic outcome with the ethical and regulatory imperative to conduct a thorough pre-induction assessment. The client's self-diagnosis and predetermined solution, while common, can obscure underlying issues or contraindications that a professional assessment is designed to uncover. The challenge lies in guiding the client through the assessment process without dismissing their agency or prematurely validating an unverified approach. The correct approach represents best professional practice because it prioritizes client safety and efficacy by adhering to the foundational principles of hypnotherapy assessment. A comprehensive pre-induction assessment, as mandated by professional guidelines for certified hypnotherapists, is crucial for establishing rapport, understanding the client's history, identifying potential contraindications for hypnosis, and collaboratively setting realistic goals. This process ensures that the hypnotherapist is equipped with the necessary information to tailor the hypnotic approach effectively and ethically, thereby maximizing the potential for positive outcomes while minimizing risks. This aligns with the ethical duty of care and the regulatory expectation that practitioners operate within their scope of competence. An incorrect approach that bypasses or superficially conducts the pre-induction assessment would represent a significant regulatory and ethical failure. Specifically, it would violate the principle of informed consent, as the client would not be fully apprised of potential risks or alternative approaches. It would also breach the duty of care by failing to identify contraindications that could lead to adverse reactions or exacerbate existing conditions. Furthermore, such an approach would disregard the professional standards and guidelines that underpin the certification, potentially leading to disciplinary action and damage to the profession's reputation. Professionals should employ a decision-making framework that begins with a commitment to ethical practice and regulatory compliance. This involves actively listening to the client's stated needs while maintaining professional objectivity. The framework should then guide the practitioner through a structured pre-induction assessment, utilizing established protocols to gather relevant information. This assessment should be a collaborative dialogue, allowing for clarification, exploration of underlying issues, and the co-creation of appropriate therapeutic goals. If the initial assessment reveals potential contraindications or a mismatch between the client's expectations and the therapeutic possibilities, the professional must ethically and transparently communicate these findings, discuss alternative strategies, and if necessary, refer the client to another professional. Question 5. The assessment process reveals that a hypnotherapist is preparing to guide a client into a hypnotic state. The therapist is considering different linguistic strategies for the induction phase. Which of the following language pattern approaches is most aligned with ethical hypnotherapy practice and maximizes client receptivity and therapeutic benefit? Option A. Utilizing direct commands and authoritative statements to ensure the client follows instructions precisely and enters a deep trance quickly. Option B. Using complex, abstract, and metaphorical language to stimulate the client's imagination and bypass conscious resistance. Option C. Incorporating language that explicitly addresses potential anxieties and negative thoughts to preemptively resolve them during induction. Option D. Employing permissive language that offers choices and suggestions, allowing the client to enter the hypnotic state at their own pace and in their own way. The correct answer is D. Employing permissive language that offers choices and suggestions, allowing the client to enter the hypnotic state at their own pace and in their own way. Explanation. The assessment process reveals a common challenge in hypnotherapy: the subtle yet significant impact of language patterns on client receptivity during induction. A hypnotherapist must navigate the ethical imperative to facilitate a client's therapeutic journey while adhering to professional standards that prioritize client well-being and autonomy. This scenario is professionally challenging because the effectiveness of an induction is not solely dependent on the therapist's intention, but critically on the client's interpretation and internal response to the chosen language. Misapplication of language patterns can inadvertently create resistance, confusion, or even unintended suggestions, undermining the therapeutic alliance and the efficacy of the session. Careful judgment is required to select language that is both suggestive and respectful of the client's conscious and subconscious processing. The correct approach represents best professional practice because it prioritizes client-centered communication and ethical guidance. By employing permissive language, the hypnotherapist acknowledges the client's active role in the hypnotic process. Permissive language such as "you might notice," "perhaps you can allow," or as you relax, empowers the client by offering choices and suggestions rather than direct commands. This aligns with the ethical guidelines for hypnotherapy, which emphasize obtaining informed consent and respecting client autonomy. Such language fosters a sense of safety and control, making the client more receptive to suggestion and less likely to experience resistance. This approach is directly supported by professional standards that advocate for non-coercive therapeutic techniques and the establishment of a strong therapeutic alliance built on trust and collaboration. An incorrect approach that relies heavily on authoritarian or direct command language, such as "you will now go into a deep trance," fails to respect client autonomy. This can be seen as a regulatory or ethical failure because it bypasses the client's conscious consent and can be perceived as manipulative or coercive. Professional guidelines typically mandate that therapeutic interventions should be collaborative and that clients should feel empowered, not compelled. Another incorrect approach might involve using overly complex or abstract language that the client cannot easily process. This can lead to confusion and frustration during the induction process and potentially causing the client to disengage. Ethically, a hypnotherapist has a duty of care to ensure their communication is clear and accessible, facilitating understanding rather than creating barriers. This failure to communicate effectively can be considered a breach of professional competence. A third incorrect approach could involve using language that inadvertently introduces negative suggestions or anxieties, such as "don't think about" or "try not to worry about." This is a significant ethical failure as it can introduce or amplify negative states, directly contradicting the therapeutic goal and potentially causing harm. Professional standards require hypnotherapists to be mindful of the potential impact of every word used. The professional reasoning process for similar situations involves a continuous assessment of the client's responses, both verbal and nonverbal. A skilled hypnotherapist will maintain flexibility in their language, adapting their approach based on the client's feedback and observed state. This involves active listening, empathy, and a deep understanding of hypnotic principles and ethical considerations. The decision-making framework should always begin with the client's well-being and therapeutic goals, followed by an evaluation of the most appropriate and ethical language patterns to achieve those goals, ensuring that the client's autonomy and comfort are paramount throughout the process. Question 6. Research into the phenomenon of time distortion experienced by a client during a hypnotherapy session for anxiety reduction. What is the most ethically sound and therapeutically effective approach for the certified hypnotherapist to take? Option A. Immediately attempt to deepen the time distortion, believing it to be a sign of profound hypnotic trance that will accelerate anxiety reduction. Option B. Acknowledge the client's experience of time distortion. Normalize it as a common aspect of hypnosis, and gently guide them back to their usual perception of time, while continuing to focus on the anxiety reduction goals. Option C. Suggest that the time distortion indicates a potential underlying psychological issue requiring immediate referral to a medical professional without further exploration within the hypnotherapy context. Option D. Dismiss the client's report of time distortion as a distraction and insist they focus solely on the anxiety reduction techniques being employed. Correct answer is B. Acknowledge the client's experience of time distortion, normalize it as a common aspect of hypnosis, and gently guide them back to their usual perception of time while continuing to focus on the anxiety reduction goals. Explanation. This scenario presents a professional challenge because the client's subjective experience of time distortion during hypnosis, while a common phenomenon, can be misinterpreted or mishandled by a hypnotherapist. It requires careful judgment to differentiate between a therapeutic response and a potential indicator of distress or a misunderstanding of the hypnotic process. The hypnotherapist must assess the client's overall well-being and the therapeutic context to determine the appropriate course of action. The correct approach represents best professional practice because it prioritizes client safety, informed consent, and therapeutic efficacy by acknowledging the client's experience, normalizing it within the context of hypnosis, and then gently guiding them back to their usual perception of time. The hypnotherapist demonstrates a skilled and ethical application of hypnotic techniques. This approach respects the client's subjective reality while ensuring they remain grounded and comfortable. It aligns with ethical guidelines that emphasize client welfare and the responsible use of hypnotic states. An incorrect approach that focuses solely on amplifying the time distortion without assessing its impact on the client's comfort or therapeutic progress would be professionally unacceptable. This could lead to client distress, anxiety, or a feeling of being out of control, potentially violating ethical principles of non-maleficence and client well-being. Another incorrect approach that dismisses the client's experience as irrelevant or a sign of failure would be equally problematic. This would invalidate the client's subjective experience, erode trust, and hinder the therapeutic relationship, contravening ethical standards of empathy and respect. Furthermore, an approach that attempts to fix the time distortion without understanding its role in the client's therapeutic goals could be seen as overstepping boundaries or misapplying techniques, potentially leading to unintended negative consequences. Professionals should employ a decision-making framework that begins with active listening and empathetic validation of the client's reported experience. This is followed by an assessment of the client's emotional state and the context of the hypnotic session. The hypnotherapist should then consider the therapeutic goals and whether the observed phenomenon is contributing positively or negatively to achieving those goals. Based on this assessment, the professional should select the most appropriate intervention, which may involve normalizing the experience, gently guiding the client, or exploring the meaning of the distortion if it is therapeutically relevant. Throughout this process, maintaining open communication and ensuring the client's comfort and safety are paramount. Question 7. Cost-benefit analysis shows that while exploring hypnotic phenomena can enhance therapeutic outcomes, the primary consideration for a certified hypnotherapist must be the client's informed understanding and consent. Which of the following approaches best reflects this principle when introducing the concept of hypnotic phenomena to a new client? Option A. Immediately induce a deep hypnotic state and guide the client to experience common phenomena like ideomotor responses and auditory hallucinations to demonstrate the power of hypnosis. Option B. Thoroughly explain the nature of hypnotic phenomena, including their subjective experience, potential variability, and the client's active role, before seeking explicit consent to explore them. Option C. Briefly mention that unusual experiences might occur during hypnosis, but emphasize that the therapist will control the process to ensure a positive outcome. Option D. Focus on the most dramatic and widely recognized hypnotic phenomena, such as age regression or past life recall, to impress the client with the potential of hypnosis. The correct answer is B. Thoroughly explain the nature of hypnotic phenomena, including their subjective experience, potential variability, and the client's active role, before seeking explicit consent to explore them. Explanation. This scenario presents a professional challenge because the hypnotherapist must balance the potential benefits of utilizing hypnotic phenomena for client well-being against the inherent risks and the need for informed consent and ethical practice. The challenge lies in accurately assessing the client's readiness and understanding of these phenomena, ensuring that their use is therapeutic and not exploitative, and maintaining professional boundaries. Careful judgment is required to avoid overpromising or misrepresenting the capabilities of hypnosis. The correct approach represents best professional practice because it prioritizes the client's autonomy and well-being by ensuring they have a clear and comprehensive understanding of hypnotic phenomena before proceeding. This aligns with the ethical principles of informed consent, beneficence, and non-maleficence, which are foundational in the certified hypnotherapist framework. By thoroughly explaining potential phenomena, their subjective nature, and the client's role in their experience, the hypnotherapist empowers the client to make an informed decision about their therapy, fostering trust and a collaborative therapeutic relationship. This proactive approach minimizes the risk of misinterpretation, disappointment, or adverse psychological reactions. An incorrect approach that involves immediately inducing deep trance states and attempting to elicit specific phenomena without prior explanation fails to uphold the principle of informed consent. This is a significant regulatory and ethical failure, as it bypasses the client's right to understand what they are consenting to and lead to the client feeling coerced, confused, or even traumatized if unexpected or distressing phenomena occur. Another incorrect approach, focusing solely on the most dramatic or commonly depicted hypnotic phenomena without acknowledging their variability or the client's individual experience, is also ethically problematic. This can create unrealistic expectations and undermine the therapeutic process if those specific phenomena do not manifest. Furthermore, failing to discuss potential risks or limitations associated with hypnotic phenomena, such as the possibility of false memories or heightened suggestibility, constitutes a breach of the duty of care and a failure to provide complete information, which are critical ethical and regulatory requirements. Professionals should employ a decision-making framework that begins with a thorough client assessment, including their understanding of hypnosis and their goals. This should be followed by a detailed explanation of hypnotic phenomena, emphasizing their subjective nature, the client's active role, and potential variability. The hypnotherapist must then obtain explicit, informed consent, ensuring the client feels comfortable and empowered to proceed or to modify the therapeutic approach. Throughout the session, ongoing communication and client feedback are crucial to monitor their experience and adjust techniques as needed, always prioritizing their safety and therapeutic benefit. Question 8. Operational review demonstrates that a comprehensive understanding of the foundational principles and historical evolution of hypnosis is critical for certified hypnotherapists. Which of the following best encapsulates the historical development and definition of hypnosis as a recognized therapeutic modality? Option A. Hypnosis is a modern invention primarily used for entertainment, with no significant historical roots in therapeutic practices. Option B. Hypnosis evolved from early practices like mesmerism, through significant contributions from figures like Charcot and Freud, to become a recognized therapeutic tool for a range of psychological and physiological conditions. Option C. Hypnosis is a form of mind control that has been consistently used throughout history to influence individuals against their will. Option D. Hypnosis originated as a theatrical performance technique and has since been scientifically validated as a method for pain management and anxiety reduction. The correct answer is D. Hypnosis originated as a theatrical performance technique and has since been scientifically validated as a method for pain management and anxiety reduction. Explanation. Scenario analysis. This scenario presents a challenge in accurately defining and contextualizing hypnosis within its historical development, which is crucial for a certified hypnotherapist to understand. Misinterpreting the historical evolution or the foundational definitions can lead to misrepresentation of the practice, potentially impacting client understanding and professional credibility. A thorough grasp of the origins and evolving definitions ensures the hypnotherapist operates with a well-informed and ethically sound perspective, aligning with the professional standards expected in the field. Correct approach analysis. The correct approach accurately reflects the historical trajectory of hypnosis, acknowledging its early associations with mesmerism and its subsequent evolution into a recognized therapeutic modality. This understanding is vital for a certified hypnotherapist, as it provides the foundational knowledge required to explain the practice to clients, differentiate it from pseudoscientific claims, and adhere to ethical guidelines that emphasize accurate representation and informed consent. Understanding the history allows for a nuanced appreciation of the techniques and theories that underpin modern hypnotherapy, ensuring practice is grounded in established principles. Incorrect approaches analysis. One incorrect approach might focus solely on the theatrical or entertainment aspects of hypnosis, neglecting its therapeutic origins and development. This fails to meet professional standards by misrepresenting the scope and purpose of hypnotherapy, potentially leading clients to have unrealistic expectations or misunderstandings about its application. Ethically, it deviates from the principle of providing accurate information and could be seen as unprofessional if it perpetuates outdated or sensationalized views. Another incorrect approach could be to present a definition that is overly simplistic or ignores the significant contributions of key figures and scientific advancements in the field. This lack of historical depth can lead to an incomplete understanding of hypnosis, hindering the hypnotherapist's ability to engage in critical thinking about its efficacy and limitations. It may also fail to satisfy the requirement for comprehensive knowledge expected of a certified professional. A further incorrect approach might conflate hypnosis with unrelated or pseudoscientific practices, failing to distinguish its established principles and research base. This is a significant ethical and professional failing, as it undermines the credibility of hypnotherapy as a legitimate therapeutic tool and could lead to the application of ineffective or even harmful techniques. It directly contravenes the need for evidence-based practice and accurate professional representation. Professional reasoning. Professionals should approach questions about the definition and history of hypnosis by first considering the established academic and clinical understanding of the field. They should recall key historical figures, seminal research, and the evolution of theoretical models. When presented with options, they should evaluate each against this foundational knowledge, prioritizing accuracy, historical context, and the distinction between therapeutic hypnosis and other phenomena. The decision-making process involves cross-referencing the provided information with established professional competencies and ethical codes that mandate accurate representation and a deep understanding of one's practice. Question 9. Which approach would be most appropriate for a certified hypnotherapist when initiating a hypnotherapy session focused on client relaxation, considering ethical practice and client well-being? Option A. Select an induction technique based on the most commonly used methods described in popular hypnotherapy literature, regardless of individual client factors. Option B. Immediately employ a rapid induction technique that is known for its speed and effectiveness in inducing a trance state. Option C. Conduct a thorough client assessment to understand their history, preferences, and any potential contraindications before selecting and explaining a suitable induction technique. Option D. Utilize a deep, progressive relaxation induction technique that has been personally successful for the therapist in similar cases. The correct answer is C. Conduct a thorough client assessment to understand their history, preferences, and any potential contraindications before selecting and explaining a suitable induction technique. Explanation. This scenario presents a challenge because the certified hypnotherapist must select an induction technique that is not only effective for the client's stated goal of relaxation, but also adheres to the ethical and regulatory standards governing hypnotherapy practice. The challenge lies in balancing client-centered care with professional responsibility, ensuring that the chosen method is safe, appropriate, and within the scope of practice. Careful judgment is required to avoid techniques that could be misapplied, lead to unintended outcomes, or violate professional boundaries. The correct approach represents best professional practice because it prioritizes a thorough client assessment and a tailored, evidence-informed selection of induction techniques. This aligns with the ethical imperative to provide competent and individualized care. By considering the client's history, preferences, and contraindications, the hypnotherapist ensures the chosen induction is safe and effective, maximizing the likelihood of achieving the desired outcome of relaxation. This client-centered, assessment-driven methodology is a cornerstone of responsible hypnotherapy practice, reflecting a commitment to client well-being and professional integrity. An incorrect approach that involves immediately applying a rapid, complex induction without prior assessment fails to meet professional standards. This could lead to client distress, anxiety, or even adverse reactions if the client is not suited for such a technique, potentially violating the duty of care. Another incorrect approach, using a technique solely based on personal preference or popularity without considering client suitability, demonstrates a lack of professional judgment and a failure to prioritize the client's needs, which is ethically unsound. Furthermore, employing an induction technique that is outside the scope of a certified hypnotherapist's training and expertise would constitute a significant regulatory and ethical breach, potentially leading to harm and professional sanctions. Professionals should employ a decision-making framework that begins with a comprehensive client intake and assessment. This includes understanding the client's goals, history, any contraindications, and their comfort level with different therapeutic approaches. Following the assessment, the professional should consider a range of evidence-based induction techniques, evaluating their suitability based on the client's profile. The selection should be collaborative, involving the client in the decision-making process where appropriate, and always prioritizing safety, efficacy, and ethical considerations. Question 10. The review process indicates that a new client expresses significant apprehension about hypnotherapy, stating they believe they will lose control of their actions and reveal deeply personal secrets against their will, as depicted in popular media. Which of the following represents the most appropriate initial response from the certified hypnotherapist? Option A. Agree with the client's assessment of hypnosis as depicted in media, suggesting that while some loss of control is possible, it is generally manageable within a therapeutic context. Option B. Gently explain that hypnosis is a state of focused attention and relaxation, not mind control, and that clients remain in control and can choose what to share, reassuring them that their privacy is paramount. Option C. Acknowledge the client's concerns but state that such beliefs are unfounded and that they should not let media portrayals influence their decision to seek therapy. Option D. Immediately begin the hypnotherapy session, assuming the client will understand the process as it unfolds and that their fears will dissipate naturally. The correct answer is B. Gently explain that hypnosis is a state of focused attention and relaxation, not mind control, and that clients remain in control and can choose what to share, reassuring them that their privacy is paramount. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified hypnotherapist to navigate client-held misconceptions about hypnosis, which can stem from popular culture and a lack of accurate information. These myths can lead to unrealistic expectations, fear, or resistance, impacting the therapeutic alliance and the effectiveness of the hypnotherapy. The hypnotherapist must address these beliefs without invalidating the client's feelings or creating further confusion, all while adhering to professional standards of practice and ethical conduct. Correct approach analysis. The correct approach involves actively listening to the client's concerns, acknowledging their beliefs, and then providing clear, evidence-based information to dispel myths. This aligns with the ethical principle of informed consent, ensuring the client understands the nature of hypnosis and its therapeutic applications. By educating the client, the hypnotherapist builds trust, manages expectation, and empowers the client to engage more effectively in the therapeutic process. This approach respects the client's autonomy and promotes a collaborative therapeutic relationship, which is fundamental to effective hypnotherapy practice. Incorrect approaches analysis. Dismissing the client's beliefs outright is an ethical failure because it demonstrates a lack of empathy and disrespects the client's perspective, potentially damaging the therapeutic relationship. It also fails to address the underlying reasons for the misconception, which could hinder progress. Overpromising results based on a misunderstanding of hypnosis, or implying that hypnosis can achieve outcomes beyond its established capabilities, constitutes a misrepresentation. This violates ethical guidelines regarding honesty and professional competence and can lead to client disappointment and a breach of trust. Ignoring the client's concerns and proceeding with the session without addressing their misconceptions fails to uphold the principle of informed consent. The client may not be fully aware of what they are agreeing to, or may be experiencing anxiety that is not being managed, thereby compromising the therapeutic process and potentially leading to adverse outcomes. Professional reasoning. Certified hypnotherapists should employ a client-centered approach that prioritizes open communication and education. When faced with client misconceptions, the professional decision-making process should involve 1. Active listening and validation. Hear the client's concerns without judgment and acknowledge their perspective. 2. Empathetic inquiry. Gently explore the source of their beliefs to understand their underlying anxieties or expectations. 3. Evidence-based education. Provide accurate, clear, and concise information about hypnosis, its mechanisms, and its limitations, tailored to the client's understanding. 4. Collaborative goal setting. Realign expectations and collaboratively set realistic therapeutic goals based on accurate information. 5. Ethical adherence. Continuously ensure that all interventions are based on informed consent, professional competence, and the client's well-being. Question 11. The analysis reveals that a certified hypnotherapist is working with a new client presenting with mild anxiety. The therapist has conducted an initial consultation and is preparing for the first hypnotic session. Considering the inherent variability in how individuals respond to hypnotic suggestion, what is the most appropriate initial strategy for the therapist to employ regarding the client's suggestibility? Option A. Assume the client is highly suggestible and proceed with the most potent therapeutic suggestions immediately. Option B. Conduct a brief, informal observation of the client's responsiveness to simple, non-critical suggestions during the induction phase to gauge their suggestibility. Option C. Focus solely on relaxation techniques without attempting any specific therapeutic suggestion until multiple sessions have passed. Option D. Begin with a series of direct, complex suggestions aimed at significantly altering the client's anxious thought patterns. The correct answer is D. Begin with a series of direct, complex suggestions aimed at significantly altering the client's anxious thought patterns. Explanation. The analysis reveals a scenario where a certified hypnotherapist must navigate the complexities of client suggestibility to ensure ethical and effective practice. This is professionally challenging because suggestibility exists on a spectrum, and misjudging a client's level can lead to ineffective hypnosis, client frustration, or even unintended negative suggestibility. Careful judgment is required to tailor hypnotic techniques appropriately, respecting the client's autonomy and the therapeutic goals. The correct approach represents best professional practice because it prioritizes an individualized assessment of suggestibility. This aligns with the ethical imperative to provide client-centered care and to use techniques that are appropriate for the individual's capacity to respond. Regulatory frameworks for certified hypnotherapists typically emphasize competence and the avoidance of harm, which necessitates understanding and adapting to a client's unique suggestibility profile. This ensures that interventions are not only safe, but also maximally beneficial, respecting the client's inherent capacity and limitations within the hypnotic state. An incorrect approach that involves applying a standardized, one-size-fits-all set of suggestions, regardless of the client's observed suggestibility, fails to meet professional standards. This could lead to suggestions being rejected by the subconscious mind, rendering the session ineffective and potentially causing the client to feel misunderstood or unsuccessful. Ethically, this demonstrates a lack of due diligence in assessing the client's needs and capacities. Another incorrect approach, such as pushing for deeper hypnotic states or more profound suggestions than the client is comfortable with or capable of, risks inducing anxiety or resistance, which is counterproductive to therapeutic goals and can be considered a form of undue influence or even harm. This violates the principle of client welfare and autonomy. A further incorrect approach might be to ignore any indicators of low suggestibility and proceed with techniques that are only effective with highly suggestible individuals, leading to wasted time and resources for both the therapist and the client, and failing to uphold professional competence. Professionals should employ a decision-making framework that begins with a thorough pre-hypnosis consultation to understand the client's expectations, history, and any prior experiences with hypnosis. During the initial stages of the hypnotic induction, the therapist should observe the client's responses to simple suggestions to gauge their level of suggestibility. This observational data, combined with the client's self-reported comfort and engagement, informs the selection and pacing of subsequent suggestions. The therapist must remain flexible, prepared to adjust techniques based on real-time feedback, and always prioritize the client's well-being and therapeutic objectives. Question 12. Market research demonstrates a growing interest in complementary therapies for chronic pain management. A client presents for hypnotherapy reporting persistent back pain that has been diagnosed by their physician as muscular strain, for which they are receiving physical therapy. The client expresses a desire for hypnotherapy to help take the edge off the pain and improve their ability to cope with discomfort during daily activities. Which of the following represents the most appropriate and ethically sound course of action for the certified hypnotherapist? Option A. Focus solely on general relaxation techniques without inquiring about the client's medical diagnosis or treatment plan, assuming that any pain management achieved through hypnotherapy is sufficient regardless of underlying medical conditions. Option B. Recommend that the client discontinue physical therapy as it may be interfering with the effectiveness of hypnotherapy, and suggest that the client rely solely on hypnotherapy for pain relief. Option C. Advise the client that hypnotherapy can directly address the root cause of muscular strain, and suggest specific hypnotic suggestions aimed at realigning the muscles and eliminating the pain, without further consultation with their medical providers. Option D. Collaborate with the client's physician and physical therapist to understand their treatment plan and integrate hypnotherapy techniques that support relaxation, pain perception management, and coping strategies, while clearly stating that hypnotherapy is a complementary approach and not a substitute for medical care. The correct answer is D. Collaborate with the client's physician and physical therapist to understand their treatment plan and integrate hypnotherapy techniques that support relaxation, pain perception management, and coping strategies, while clearly stating that hypnotherapy is a complementary approach and not a substitute for medical care. Explanation. This scenario presents a professional challenge because the certified hypnotherapist must navigate the ethical and regulatory boundaries of pain management without overstepping into the practice of medicine. The core of the challenge lies in distinguishing between providing supportive hypnotherapy for pain management and offering medical advice or treatment, which is outside the scope of practice for a hypnotherapist. Careful judgment is required to ensure client safety, maintain professional integrity, and adhere strictly to the regulatory framework governing hypnotherapy. The correct approach represents best professional practice because it prioritizes client well-being and adheres to the established scope of practice for a certified hypnotherapist. By focusing on techniques that support the client's coping mechanisms and perception of pain, while explicitly deferring medical diagnosis and treatment to qualified healthcare professionals, the hypnotherapist acts ethically and within regulatory guidelines. This approach ensures that the client receives appropriate care from all relevant professionals, and that the hypnotherapist does not engage in activities that could be construed as unlicensed medical practice. This aligns with the principle of do no harm and the requirement to operate within one's defined professional competencies. An incorrect approach that involves suggesting specific medical interventions or diagnosing the cause of the pain is a significant regulatory and ethical failure. This constitutes the unlicensed practice of medicine, which is a serious offense and can lead to severe legal and professional repercussions, including loss of certification and potential lawsuits. Another incorrect approach, such as dismissing the client's pain or suggesting hypnotherapy as a sole cure for a serious medical condition without medical consultation, demonstrates a lack of professional responsibility and a failure to uphold ethical standards. This can result in harm to the client by delaying or preventing them from seeking necessary medical attention. Professionals should employ a decision-making framework that begins with clearly defining the scope of their practice. When faced with a client presenting with pain, the first step is to inquire about their existing medical care and encourage them to consult with a physician for diagnosis and treatment. The hypnotherapist's role is then to offer supportive techniques that can complement medical care, focusing on relaxation, stress reduction, and altered perception of discomfort, always within the bounds of hypnotherapy. This framework emphasizes collaboration with other healthcare providers and a commitment to client safety and ethical conduct. Question 13. Process analysis reveals that during a hypnotherapy session aimed at stress reduction, a client reports experiencing a sensation of floating away and a feeling of detachment from their physical body, which is a novel and somewhat unsettling experience for them. What is the most appropriate professional response for the certified hypnotherapist? Option A. Interpret the floating away sensation as a sign of resistance and attempt to push the client deeper into the altered state to overcome this perceived resistance. Option B. Gently inquire about the client's feelings and sensations associated with the floating away experience, reassuring them that such sensations can occur and are often temporary, while continuing to guide them towards their stress reduction goal. Option C. Inform the client that this sensation is not a typical or desirable outcome of hypnotherapy and suggest they may not be a suitable candidate for the process. Option D. Immediately guide the client back to full waking consciousness, as any unexpected or unsettling sensation indicates a potential negative outcome of the altered state. The correct answer is B. Gently inquire about the client's feelings and sensations associated with the floating away experience, reassuring them that such sensations can occur and are often temporary, while continuing to guide them towards their stress reduction goal. Explanation. This scenario presents a professional challenge because it requires the certified hypnotherapist to navigate the delicate balance between facilitating a client's desired altered state of consciousness and ensuring the client's safety and well-being within the established ethical and regulatory boundaries. The core of the challenge lies in understanding the client's subjective experience of an altered state and responding appropriately without overstepping professional competence or engaging in practices that could be misconstrued as manipulative or harmful. The regulatory framework for certified hypnotherapists emphasizes client autonomy, informed consent, and the avoidance of harm. The correct approach represents best professional practice because it prioritizes a collaborative and client-centered process. By actively seeking the client's feedback on their experience of the altered state, the hypnotherapist demonstrates respect for the client's subjective reality and agency. This approach aligns with ethical guidelines that mandate ongoing assessment and adaptation of therapeutic techniques based on the client's responses. It also ensures that the hypnotherapist remains within their scope of practice, focusing on facilitating the client's internal experience rather than imposing external interpretations or directives that could be detrimental. This fosters trust and reinforces the therapeutic alliance, which is crucial for effective hypnotherapy. An incorrect approach that involves the hypnotherapist unilaterally deciding the optimal or correct nature of the altered state for the client represents a significant ethical and regulatory failure. This demonstrates a lack of respect for client autonomy and can be interpreted as imposing the therapist's agenda, which is contrary to the principle of client-centered care. Such an approach could lead to the client feeling invalidated or misunderstood, potentially causing distress and undermining the therapeutic process. It also risks the therapist operating outside their defined scope of practice by making assumptions about the client's internal experience that are not grounded in the client's own report. Another incorrect approach, such as immediately terminating the session upon the client reporting an unusual or unexpected sensation within the altered state, without further exploration or reassurance, is also professionally unacceptable. While vigilance for client distress is important, an abrupt termination without attempting to understand the sensation or offer support can be perceived as abandonment and can create anxiety for the client. This fails to uphold the ethical duty of care and the principle of beneficence, which requires the therapist to act in the client's best interest and to provide appropriate support throughout the session. The professional decision-making process for similar situations should involve a continuous loop of assessment, intervention, and reassessment, always with the client's subjective experience at the forefront. Professionals must maintain a curious and open stance, actively listening to the client's verbal and nonverbal cues. When a client reports an experience within an altered state, the immediate professional response should be to acknowledge, validate, and gently inquire further to understand the nature and impact of that experience. This allows the therapist to gauge whether the experience is within the expected range of hypnotherapy outcomes, or if it requires a different approach, such as de-escalation, further exploration, or even a referral if it suggests an issue beyond the scope of hypnotherapy. The guiding principle is always to empower the client and ensure their safety and therapeutic progress. Question 14. During the evaluation of a client presenting with a desire to explore altered states of consciousness and potentially experience phenomena related to physical stillness, what is the most ethically sound and professionally responsible initial step for a certified hypnotherapist regarding the exploration of catalepsy and motor control? Option A. Recommend the client seek a medical diagnosis for any perceived motor control issues before engaging in hypnotherapy, without further exploration of the topic within the hypnotherapy session. Option B. Conduct a thorough pre-hypnosis assessment of the client's physical and psychological history, including any pre-existing neurological or motor control conditions, and obtain explicit, informed consent for exploring catalepsy and motor control. Option C. Immediately proceed with guided imagery techniques designed to induce a state of profound physical stillness and reduced motor responsiveness, assuming the client's request implies readiness. Option D. Focus solely on the client's stated desire for altered states, employing general relaxation techniques without specifically addressing or consenting to the exploration of catalepsy or motor control. The correct answer is B. Conduct a thorough pre-hypnosis assessment of the client's physical and psychological history, including any pre-existing neurological or motor control conditions, and obtain explicit, informed consent for exploring catalepsy and motor control. Explanation. This scenario presents a professional challenge due to the inherent risks associated with inducing or managing catalepsy and motor control phenomena during hypnotherapy. The certified hypnotherapist must navigate the fine line between therapeutic intervention and potential harm, requiring meticulous assessment, informed consent, and adherence to established protocols. The primary concern is the client's safety and well-being, ensuring that any exploration of catalepsy or motor control is conducted within ethical boundaries and with a clear understanding of the client's physiological and psychological state. The correct approach, which involves a thorough pre-hypnosis assessment of the client's physical and psychological history, including any pre-existing neurological or motor control conditions, and obtaining explicit, informed consent for exploring catalepsy and motor control, represents best professional practice. This aligns with the fundamental ethical principles of beneficence and non-maleficence, ensuring that the hypnotherapist acts in the client's best interest and avoids causing harm. Regulatory frameworks for certified hypnotherapists typically mandate such comprehensive assessments and consent procedures to protect clients and uphold professional standards. This proactive approach minimizes risks and ensures that the client is fully aware of the potential experiences and implications. An incorrect approach that involves proceeding with techniques to induce catalepsy or alter motor control without a comprehensive pre-hypnosis assessment of the client's medical and psychological history is a significant regulatory and ethical failure. This bypasses the crucial step of identifying contraindications or pre-existing conditions that could be exacerbated by such interventions, violating the duty of care. Another incorrect approach, failing to obtain specific, informed consent for the exploration of catalepsy and motor control, even if a general consent for hypnotherapy was given, is also a breach of ethical guidelines and potentially regulatory requirements. Informed consent must be specific to the techniques and potential outcomes, especially those involving altered motor control. Furthermore, attempting to induce catalepsy without adequate training or supervision, or without a clear therapeutic rationale directly linked to the client's stated goals, constitutes professional misconduct and a violation of practice standards. The professional decision-making process for similar situations should begin with a robust intake and assessment phase. This includes gathering detailed information about the client's presenting issues, medical history, psychological history, and any relevant lifestyle factors. If the client expresses interest in, or if the therapeutic goals suggest exploring phenomena like catalepsy or motor control, the hypnotherapist must then conduct a specific risk-benefit analysis. This analysis should inform the process of obtaining explicit, informed consent, ensuring the client understands the nature of the techniques, potential outcomes, both positive and negative, and their right to withdraw at any time. The hypnotherapist must also consider their own scope of practice and competence, referring to a medical professional if any concerns arise regarding the client's physical or neurological health. Question 15. Benchmark analysis indicates that a client presents with a request to undergo hypnotic amnesia to forget a specific traumatic event. The certified hypnotherapist has assessed the client's general mental well-being and the nature of the event, considering the ethical and professional responsibilities of a certified hypnotherapist. Which of the following represents the most appropriate course of action? Option A. Refuse the client's request for hypnotic amnesia entirely and suggest they seek psychological therapy for trauma processing. Option B. Immediately induce deep hypnotic amnesia for the traumatic event, as requested by the client, without further discussion of risks or alternative strategies. Option C. Proceed with a gradual and controlled induction of hypnotic amnesia, ensuring thorough informed consent, monitoring the client's response, and establishing a plan for potential reversal and post-hypnotic support. Option D. Induce hypnotic amnesia for the traumatic event, and provide post-hypnotic suggestions to ensure the memory remains permanently inaccessible. The correct answer is C. Proceed with a gradual and controlled induction of hypnotic amnesia, ensuring thorough informed consent, monitoring the client's response, and establishing a plan for potential reversal and post-hypnotic support. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risks associated with inducing hypnotic amnesia. The primary concern is the potential for unintended consequences, such as the client experiencing distress or confusion upon recall of the forgotten material, or the amnesia becoming permanent or difficult to reverse. The certified hypnotherapist must navigate the ethical imperative to do no harm while fulfilling the client's request, requiring a nuanced understanding of hypnotic techniques and their implications. The client's stated desire to forget a specific traumatic event, while understandable, necessitates a cautious and well-informed approach, prioritizing the client's overall well-being and mental stability. Correct approach analysis. The correct approach prioritizes client safety, informed consent, and adherence to ethical guidelines for hypnotherapy. This involves a thorough pre-hypnosis assessment to understand the client's mental state, the nature of the memory, and potential risks. It also requires obtaining explicit, informed consent, detailing the process, potential outcomes, and the possibility of partial or complete memory recall. The hypnotherapist should employ a gradual and controlled induction of amnesia, utilizing techniques that allow for reversibility and monitoring the client's response throughout the session. Post-hypnotic suggestions for comfort and integration, along with a plan for follow-up support, are crucial. This approach aligns with the ethical principles of beneficence, non-maleficence, and respect for client autonomy, as generally understood within professional hypnotherapy practice, ensuring the client's welfare is paramount. Incorrect approach is analysis. One incorrect approach involves immediately proceeding with deep hypnotic amnesia induction without adequate assessment or informed consent. This violates the ethical principle of informed consent, as the client has not been fully apprised of the risks and benefits. It also demonstrates a failure to adhere to the principle of non-maleficence by potentially exposing the client to harm without proper safeguards. Another incorrect approach is to refuse the client's request outright without exploring alternative therapeutic strategies or understanding the underlying reasons for the request. While caution is warranted, a complete refusal without offering other forms of support or explanation can be perceived as a failure of beneficence and a lack of professional engagement with the client's expressed needs. A third incorrect approach is to induce amnesia without planning for its potential reversal or monitoring the client's post-hypnotic state. This creates a significant risk of unintended long-term consequences, such as the client experiencing persistent memory gaps or emotional distress, which is a direct contravention of the duty of care and the principle of non-maleficence. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive client assessment, including a review of their mental health history and the specific nature of the memory they wish to forget. This is followed by a detailed discussion of the proposed hypnotic techniques, potential outcomes, risks, and benefits, leading to the acquisition of fully informed consent. The hypnotherapist must then select and apply techniques cautiously, with a focus on reversibility and client comfort, continuously monitoring the client's state. Finally, a post-hypnotic plan for integration and support should be established. This systematic approach ensures that the client's autonomy is respected, their well-being is protected, and the hypnotherapist acts within ethical and professional boundaries. Question 16. Compliance review shows a certified hypnotherapist is treating a client experiencing a severe phobia of flying. The client reports debilitating panic attacks at the mere thought of air travel, which significantly impacts their career and personal life. The hypnotherapist has assessed the client's history and current presentation. Which of the following therapeutic approaches best aligns with best practices for treating phobias using hypnotherapy? Option A. Implementing a gradual exposure hierarchy, starting with imagining flying scenarios and progressing to more vivid visualizations of flying, while utilizing hypnotic suggestion for relaxation and confidence building at each stage. Option B. Focusing exclusively on general relaxation and stress reduction techniques during hypnosis, without directly addressing the specific triggers or feared outcomes associated with flying. Option C. Recommending the client immediately book a flight and use deep breathing exercises during the flight to manage any panic that arises. Option D. Conducting a single, intensive session aimed at directly confronting the fear of flying through powerful, direct hypnotic suggestion to eliminate the phobia immediately. The correct answer is A. Implementing a gradual exposure hierarchy, starting with imagining flying scenarios and progressing to more vivid visualizations of flying, while utilizing hypnotic suggestion for relaxation and confidence building at each stage. Explanation. This scenario presents a professional challenge because it requires a hypnotherapist to navigate the complexities of treating a client with a severe phobia while adhering strictly to established best practices and ethical guidelines. The client's intense fear and potential for distress necessitate a cautious and evidence-based approach. The challenge lies in selecting the most appropriate therapeutic modality that is both effective for anxiety and phobias, and within the scope of practice for a certified hypnotherapist. Ensuring client safety and well-being are paramount. The correct approach represents best professional practice because it prioritizes a structured, evidence-based intervention specifically designed for phobias, which is systematic desensitization. This method, often integrated with hypnotherapy, involves gradual exposure to the feared stimulus in a controlled and safe environment, allowing the client to develop coping mechanisms and reduce their anxiety response. This aligns with the ethical imperative to provide competent care and to utilize techniques that have demonstrated efficacy for the client's presenting issue. It also respects the client's autonomy by involving them in the process and ensuring their comfort at each stage. An incorrect approach involving immediate, intense exposure without prior preparation or gradual acclimatization is ethically and professionally unacceptable. This could lead to significant client distress, re-traumatization, and a breach of the duty of care. Such an approach fails to adhere to the principle of do no harm and demonstrates a lack of understanding of appropriate phobia treatment protocols. Another incorrect approach, focusing solely on relaxation techniques without addressing the underlying phobic response through exposure or cognitive restructuring, is also professionally deficient. A relaxation is a valuable component of anxiety management. It does not directly confront and modify the phobic stimulus response. This approach may offer temporary relief, but fails to provide a comprehensive and lasting solution for the phobia, potentially leading to client dissatisfaction and a failure to achieve therapeutic goals. A third incorrect approach, recommending a rapid, one-session cure for a severe phobia, is unrealistic and ethically questionable. Phobia treatment typically requires a process of gradual change and skill development. Promising immediate eradication of a deep-seated fear is misleading and sets unrealistic expectations, potentially damaging the therapeutic alliance and the client's trust in hypnotherapy. It also disregards the client's individual pace of progress and the inherent complexity of anxiety disorders. The professional decision-making process for similar situations should involve a thorough assessment of the client's presenting problem, including the nature and severity of the phobia. This should be followed by a review of evidence-based treatment modalities for anxiety and phobias that fall within the hypnotherapist's scope of practice. Collaboration with the client to establish realistic goals and a treatment plan, emphasizing gradual progress and client comfort, is crucial. Continuous evaluation of the client's response to treatment and adaptation of the approach as needed are also essential components of best professional practice. Question 17. Regulatory review indicates that certified hypnotherapists must select techniques that are both effective and ethically sound for individual clients. Considering a client presenting with mild anxiety and a desire to improve sleep quality, which of the following approaches best aligns with these regulatory and ethical imperatives? Option A. Recommending the client exclusively practice self-hypnosis techniques found online without a prior assessment of their suitability or the client's ability to implement them effectively. Option B. Applying a standardized, one-size-fits-all traditional hypnosis script for anxiety and sleep, regardless of the client's individual responses or preferences during the session. Option C. Employing Ericksonian hypnosis, focusing on indirect suggestions and utilizing the client's own metaphors and experiences to facilitate relaxation and positive sleep associations. Option D. Directly instructing the client to enter a deep trance state using authoritarian commands, assuming this is the most efficient method for all sleep-related issues. The correct answer is C. Employing Ericksonian hypnosis, focusing on indirect suggestions and utilizing the client's own metaphors and experiences to facilitate relaxation and positive sleep associations. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in client needs and the diverse landscape of hypnotherapy techniques. A certified hypnotherapist must exercise careful judgment to select the most appropriate modality, ensuring client safety, efficacy, and adherence to professional standards. The challenge lies in moving beyond a one-size-fits-all approach and demonstrating a nuanced understanding of different hypnotic styles and their suitability for specific client presentations. Correct approach analysis. The correct approach involves a thorough client assessment to determine the most suitable type of hypnosis. This aligns with best professional practice by prioritizing client-centered care. Regulatory frameworks for certified hypnotherapists typically emphasize the importance of informed consent and the therapist's responsibility to utilize techniques that are evidence-based and appropriate for the client's presenting issues. Ericksonian hypnosis, with its indirect suggestion and focus on the client's own resources, is often highly effective for a broad range of issues, including anxiety, phobias, and habit change, as it respects the client's unique communication style and internal world. This approach is ethically sound as it empowers the client and fosters a collaborative therapeutic relationship, which is a cornerstone of responsible hypnotherapy practice. Incorrect approaches analysis. Utilizing only traditional, authoritarian hypnosis without considering the client's receptivity or preferences can be ethically problematic. While effective for some, it may alienate or be counterproductive for others, potentially leading to client dissatisfaction or a perceived lack of progress, which could be seen as a failure to provide competent care. Relying solely on self-hypnosis without proper guidance or assessment for a client presenting with complex issues is also a regulatory and ethical failure. Self-hypnosis requires a degree of self-awareness and control that may not be present in all clients, and attempting to guide a client solely towards self-hypnosis without a foundational understanding of their needs could be considered negligent if it bypasses more appropriate therapeutic interventions. Recommending a single, unverified technique as universally superior without client-specific assessment is a failure to adhere to the principle of individualized treatment and could be viewed as a breach of professional duty of care. Professional reasoning. Professionals should employ a decision-making framework that begins with a comprehensive client intake and assessment. This involves understanding the client's history, presenting problem goals, and their receptivity to different therapeutic approaches. Following the assessment, the therapist should consider the evidence base for various hypnotherapy modalities in relation to the client's specific needs. Informed consent is paramount, requiring the therapist to explain the proposed techniques, their potential benefits, risks, and alternatives, allowing the client to participate actively in the treatment planning process. Continuous evaluation of the client's progress and responsiveness to the chosen technique is also essential, with a willingness to adapt the approach as needed. Question 18. Compliance review shows a certified hypnotherapist is integrating mindfulness-based stress reduction techniques and cognitive behavioral therapy principles into their hypnotherapy sessions to address client anxiety. The hypnotherapist is also providing clients with interpretations of their subconscious material during sessions, suggesting potential underlying psychological conflicts. Which of the following best describes the professional and ethical considerations for this integrative approach? Option A. The hypnotherapist is ethically justified in interpreting subconscious material and suggesting potential psychological conflicts, as this enhances the depth of the hypnotherapy experience and client insight. Option B. The hypnotherapist is acting within their scope by interpreting subconscious material, as this is a core component of advanced hypnotherapy practice aimed at uncovering root causes of issues. Option C. The integration of CBT principles is permissible, but the hypnotherapist should actively seek to diagnose underlying psychological disorders to provide more targeted hypnotherapy interventions. Option D. The integration of mindfulness and CBT principles is acceptable as long as the hypnotherapist maintains a focus on hypnotic suggestion and avoids making definitive psychological diagnoses or medical recommendations. Correct answer is D. The integration of mindfulness and CBT principles is acceptable as long as the hypnotherapist maintains a focus on hypnotic suggestion and avoids making definitive psychological diagnoses or medical recommendations. Explanation. This scenario presents a professional challenge because integrative hypnotherapy, by its nature, blends techniques from various therapeutic modalities. A certified hypnotherapist must ensure that any integration remains within the scope of their practice and adheres to the ethical guidelines and regulatory framework governing hypnotherapy. The challenge lies in distinguishing between legitimate integration that enhances therapeutic outcomes and practices that might inadvertently cross into the domain of other licensed professions without proper qualification or licensure. The correct approach represents best professional practice because it prioritizes client safety and professional integrity by clearly defining the boundaries of hypnotherapy and ensuring that integrated techniques are complementary and do not constitute the practice of another profession, e.g., psychotherapy, medical diagnosis. The hypnotherapist upholds the ethical standards of the profession. This approach aligns with the principle of practicing within one's competence and scope, as mandated by ethical codes and potentially by regulatory bodies that define professional practice. It ensures that the client receives hypnotherapy services that are appropriate, effective, and ethically delivered, without the risk of misrepresentation or unauthorized practice. An incorrect approach that involves diagnosing mental health conditions using hypnotherapy techniques would be a significant regulatory and ethical failure. This is because diagnosing mental health conditions is typically reserved for licensed mental health professionals, e.g., psychologists, psychiatrists, licensed clinical social workers, and requires specific education, training, and licensure. A hypnotherapist, even when integrating other modalities, is not authorized to diagnose. This failure constitutes practicing outside the scope of hypnotherapy and potentially engaging in unlicensed practice of another profession, which is a serious ethical breach and a violation of regulatory frameworks designed to protect the public. Another incorrect approach, such as using hypnotherapy to prescribe or recommend specific medical treatments or interventions, would also be a critical failure. Medical diagnosis and treatment are the exclusive domain of licensed medical practitioners. A hypnotherapist's role is to facilitate change through hypnotic suggestion and related techniques, not to provide medical advice or treatment plans. Engaging in such practices would be a direct violation of medical practice acts and ethical guidelines for hypnotherapy, posing a severe risk to client health and safety. The professional decision-making process for similar situations should involve a clear understanding of the scope of practice for certified hypnotherapists. This includes recognizing the boundaries between hypnotherapy and other professions like psychotherapy and medicine. When considering integrative approaches, professionals must ask, does this integrated technique fall within the established scope of hypnotherapy, or does it require specialized licensure in another field? If the latter, the professional must either possess the necessary licensure and training or refer the client to an appropriate professional. Continuous professional development that focuses on ethical practice and scope of practice is crucial. Furthermore, maintaining clear and transparent communication with clients about the nature and limitations of hypnotherapy services is paramount. Question 19. The assessment process reveals a client presenting with persistent insomnia, reporting difficulty falling asleep and staying asleep for several months, impacting their daily functioning. The client expresses a desire to explore hypnotherapy as a primary treatment. Considering the regulatory framework for certified hypnotherapists, what is the most appropriate initial course of action? Option A. Advise the client to try over-the-counter sleep aids in conjunction with hypnotherapy to address the sleep difficulties more effectively. Option B. Recommend a comprehensive medical evaluation by a physician or sleep specialist to rule out underlying medical or psychological conditions contributing to the insomnia, and then proceed with hypnotherapy for symptom management if medically cleared. Option C. Immediately commence a series of hypnotherapy sessions focused on relaxation techniques and sleep induction, assuming the insomnia is primarily stress-related and within the scope of hypnotherapy. Option D. Diagnose the insomnia as a psychological issue and proceed with hypnotherapy to address the root psychological causes without further medical consultation. The correct answer is B. Recommend a comprehensive medical evaluation by a physician or sleep specialist to rule out underlying medical or psychological conditions contributing to the insomnia, and then proceed with hypnotherapy for symptom management if medically cleared. Explanation. The assessment process reveals a client presenting with persistent insomnia, a common sleep disorder. As a certified hypnotherapist, the professional challenge lies in accurately identifying the scope of practice and ensuring that interventions are within the established regulatory framework for hypnotherapy, particularly when dealing with conditions that may have underlying medical or psychological components. The primary ethical and regulatory imperative is to avoid practicing outside one's competence or making diagnoses that are the purview of licensed medical professionals. The correct approach represents best professional practice because it prioritizes client safety and adheres strictly to the scope of practice for a certified hypnotherapist. By recognizing the potential for underlying medical or psychological issues contributing to insomnia, the professional correctly refers the client to a physician or sleep specialist for a comprehensive medical evaluation. This ensures that the client receives appropriate diagnosis and treatment for any co-occurring conditions, such as sleep apnea, restless leg syndrome, or significant anxiety disorders, which hypnotherapy alone cannot address and may even exacerbate if not properly managed. This aligns with ethical guidelines that mandate practitioners to operate within their areas of expertise and to seek consultation or refer when a client's needs exceed their training or licensure. An incorrect approach that involves directly attempting to treat the insomnia solely through hypnotherapy without a medical referral fails to acknowledge the potential for underlying pathology. This could lead to a delay in proper medical diagnosis and treatment, potentially worsening the client's condition or leading to adverse health outcomes. Ethically, this constitutes practicing beyond the scope of competence and could be construed as negligence. Another incorrect approach, such as diagnosing the insomnia as purely psychological without medical consultation, also oversteps the boundaries of a hypnotherapist's role, as a formal diagnosis of a sleep disorder typically requires medical expertise. This bypasses essential medical assessment and could result in ineffective or even harmful interventions. A further incorrect approach, such as recommending over-the-counter sleep aids, is also problematic as it ventures into medical advice, which is outside the scope of practice for a hypnotherapist and could interfere with prescribed medical treatments. A professional decision-making process for similar situations should involve a thorough initial assessment to identify presenting issues and potential contributing factors. If the presenting issue, like persistent insomnia, suggests potential underlying medical or psychological conditions, the first step should always be to recommend a comprehensive evaluation by a qualified medical professional. The hypnotherapist should then collaborate with the medical team, if appropriate and with client consent, to integrate hypnotherapy as a complementary modality within the established medical treatment plan, ensuring all interventions are evidence-based and within the defined scope of practice. Question 20. Implementation of a pre-induction assessment for a new client who has specifically requested a particular advanced hypnotic technique. What is the most ethically and regulatorily sound initial step for a certified hypnotherapist? Option A. Ask the client to sign a waiver acknowledging they are requesting a specific technique, thereby absolving the hypnotherapist of responsibility for any outcomes related to its application. Option B. Immediately begin the requested advanced hypnotic technique, assuming the client's request indicates they are a suitable candidate and knowledgeable about its benefits. Option C. Conduct a thorough and comprehensive pre-induction assessment, including gathering detailed client history, understanding their goals, identifying any contraindications, and collaboratively determining the most appropriate hypnotic approach, which may or may not be the initially requested technique. Option D. Briefly explain the requested advanced hypnotic technique to the client, and then proceed, as their specific request should be honored without further inquiry. The correct answer is B. Immediately begin the requested advanced hypnotic technique, assuming the client's request indicates they are a suitable candidate and knowledgeable about its benefits. Explanation. This scenario presents a professional challenge because the certified hypnotherapist must balance the client's expressed desire for a specific hypnotic technique with the ethical and regulatory obligation to ensure the client is a suitable candidate for hypnosis and that the chosen technique aligns with their needs and safety. The regulatory framework for certified hypnotherapists emphasizes a thorough pre-induction assessment to establish rapport, understand the client's goals, identify contraindications, and determine the most appropriate approach. This assessment is not merely a formality, but a critical step in ensuring client well-being and adherence to professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment. This involves gathering detailed information about the client's history, current concerns, expectations, and any potential contraindications to hypnosis. It also includes explaining the hypnotic process, managing expectations, and collaboratively determining the most suitable techniques. This aligns with the regulatory requirement to practice competently and ethically, ensuring that interventions are safe, effective, and tailored to the client's unique situation. The focus on building rapport and trust is also paramount, as it forms the foundation for a successful therapeutic relationship. An incorrect approach that bypasses or inadequately performs the pre-induction assessment fails to meet regulatory and ethical standards. Specifically, proceeding with a technique without a thorough understanding of the client's medical history could lead to adverse reactions or exacerbate existing conditions, violating the duty of care. Similarly, ignoring the client's stated goals or imposing a technique without client consent or understanding undermines autonomy and informed consent, which are fundamental ethical principles. Failing to identify potential contraindications, such as certain psychological disorders or substance abuse issues, could result in harm, directly contravening the regulatory imperative to practice safely and responsibly. The professional decision-making process for similar situations should involve a structured, client-centered approach. This begins with active listening and empathetic engagement to understand the client's perspective. It then moves to systematic information gathering, including a detailed history and exploration of presenting issues. Crucially, this information must be analyzed to identify potential risks and benefits, contraindications, and the most appropriate therapeutic pathways. The process should culminate in a collaborative discussion with the client, where options are presented, expectations are managed, and informed consent is obtained before any intervention begins. This iterative process ensures that decisions are evidence-based, ethically sound, and aligned with the client's best interests.